Hello and welcome to Neurona QL. I'm Gearta Kraja and I'm thrilled to have you here. At Neurona QL, my mission is to celebrate the extraordinary power of the human mind and inspire all of us to unlock our full potential for a high-quality life. Today's episode is all about fatty liver disease, an increasingly common condition that affects people of all ages. I'm joined today by Dr. Sajjad, who will share her extensive experience in treating this issue. We'll explore everything from the root causes to early warning signs, plus holistic and alternative treatment methods, focusing on nutrition, sleep, supplements, and the often overlooked role of mental health. My hope is that this conversation empowers you not only to take proactive steps for your health, but also to tap into the boundless capacity of your mind. Let's get started. Today, we are with Dr. Sajjad again on another interesting episode where she'll be speaking about fatty liver disease, and I'm so excited to have her again today. And hi, Dr. Sajjad.
Hi.
Welcome again.
Yeah. So how was our Christmas?
It was good. Everything is going well, and I'm excited to be having this conversation. Let's get right into what is fatty liver? What are some of for the people that don't have an understanding or for the people that have a small understanding of it?
Okay, so actually this is for like common people to understand, not for like, doctors or professionals to understand. They probably know what is fatty liver. Fatty liver means that fat gets deposited in your liver. Liver should not have any fat inside. Okay, so of course, there must be some problems that liver gets fatty. And this fatty liver disease is very, very common these days. Even imagine it is found in kids, 5-year-olds, also have been found to have fatty livers. Before, they used to say that only people who drink a lot get fatty liver. But now, I think non-alcoholic fatty liver is much more common than the alcoholic fatty liver disease. All right. And now even kids are not like spared. The most common issue is the diet. The diet, it's not the fat in the diet which causes fatty liver. It is the carbohydrates. And carbohydrates also, not the vegetables. They're called complex carbohydrates. They are not the ones which are causing the fatty liver. It is the like sugar and flour, rice, and whatever this standard American diet which people are eating these days is really the cause of fatty liver disease. So liver does like 500 functions in the body. And if the liver gets fatty, now you can imagine, those 500 functions are compromised. Liver cannot do it as it should do. So the body suffers, right? So the main causes are like, to mention a few, they are like obesity. People are obese these days. So as the fat develops under the skin and around their viscera, it develops inside their fat and liver also. So that causes fatty liver. So this second is diabetes. Because diabetics have high glucose in the blood. So that glucose is stored as glycogen in the liver, right? When the liver is full of capacity of storing glycogen, it starts storing fat as such, right? Yeah, so that's one. Then insulin resistance. These days, insulin is a culprit, okay? Right. It is the cause of many issues. Okay, so people with type 2 diabetes, it's not that, people think that, okay, it's the insulin, which is more insulin in their body, which is, causing, of course, they have more insulin in the body, but body is not able to utilize that insulin to lower their blood sugar. Insulin cannot get into their cells. So that high insulin in the blood, what it does, it starts storing fat. It starts storing fat in the body everywhere, and it does not spare the liver. So it stores the fat in the liver as well. So causes fatty liver. Then nutritional deficiencies, of course, people who are, deficient in minerals and vitamins and omega-3s, fatty acids, whatever, also is one of the causes. Second thing, high blood pressure. High blood pressure also insulin resistance is the cause of high blood pressure as well, because, it causes everything.
Like a
So, of
circle
course,
said.
exactly. Then diabetes, of course, that is then also ultra processed food, also already mentioned, because it's sad diet, or, standard American diet is very, very ultra processed, and it's very cheap. This is the irony. It is cheap.
And it's
So,
addicting.
yes. And the people think that, okay, why should they spend like $20 on a good diet when they can get a burger, from McDonald's or Burger King or wherever for $2-3. I don't know how much it is now, but because I never go there. So it used to be very, very cheap. And it must be very cheap also now, even because, every prices have been raised. So if good diet or good vegetables or good, prices are raised, of course, the burgers prices also must be raised, whatever, maybe it was $2 before, now it must be $4, whatever, but it is cheap. Anyway, and then, of course, our water, our environment, everything is polluted. There are chemicals in the water. There is chlorinated water. They clean the water with chlorine. They, when in the crops, they put like chemicals, pesticides, fertilizers, which are all chemicals. So those chemicals and fertilizers get into whatever is in the vegetables also. So then those vegetables or whatever crops, they also have chemicals in it. So when people consume it, it causes that. So alcohol, of course, everybody knows. Nobody has to,
That's a
everybody.
specific alcoholic fatty liver disease. So that has
Exactly. There's always, you think that it is the alcohol. So I'm not drinking alcohol. So why did I have fatty liver? So this is to tell those people that alcohol is now probably a minute cause, not the bigger cause. Anyway, so there are some medications, even the Tylenol. People take Tylenol as candies. Ibuprofen. It also, naproxen, ibuprofen, all these, that class of NSAIDs, which is called, they can also cause. Okay, tamoxifen. Tamoxifen is a medication which is given to breast cancer patients, right? That also causes fatty liver. So you know how cancers are common now these days. Methotrexate, chemotherapies, whatever, methotrexate is the chemotherapy, and is now given for autoimmune diseases also. I mean, it is given for rheumatoid arthritis. So you see, I don't know how far it can treat the rheumatoid arthritis or whatever, but it destroys the whole body. And of course, then it does develop fat in the liver as well, like antifungals, steroids, anti-epileptics, valproate, amiodarone, and of course the recreational drugs, heroin, morphine, codeine, amphetamines, right? Even some vitamins taken in large doses can cause these things. All right, so initial stages, now you will be asking me, okay, then how people will know that they have fatty liver disease, right? Initially, they will not have any symptoms. So later on, they will have, fatigue, jaundice, weight loss, brain fog, loss of appetite, confusion, pain, in the bodies, whatever, in the ribs, enlarged liver, bloating, GERD, bruising, dark urine. So my question is that, early stages, they will not know. But what I will emphasize that everybody should get their, tests done, maybe, at least twice a year or something like that, so that they can find out if they have any issues.
What is the
And
marker
first-
that they should watch out for?
Yeah. So markers are, their liver enzymes are elevated.
Mhm.
So if liver enzymes are elevated, then they should say, to their doctor, maybe they can have a ultrasound or MRI of the liver and see if there is, any fat deposits are there. And usually what the conventional doctors will say, I have seen many patients, they come to me and they say, oh, there is no treatment for fatty liver.
Mhm.
So that is an irony. I think there is treatment for a fatty liver. And patients should know that it is, because once the disease gets very advanced, then it can, of course, they will go into liver failure. And liver transplants is then the answer to that. The liver transplant is either from one of their, relatives, like mother, father, siblings, or it will be from outside somewhere. Then they will have to be on those like suppressants, so that, the transplant is not rejected. So that also, of course, will hamper their immune function. So it will lower their immunity, because immunity will fight the transplant.
It fixes one thing and it destroys the others.
Exactly. That's what I'm saying. So what is it? What is the lesson we learn? The lesson we learn is to avoid getting into that stage that leads them to liver transplant. Right? So that's what it is.
One of the things that I liked from you is that you said there is a treatment to it. So other than, okay, we're eating healthy, we're doing everything, but someone still has the fatty liver disease, right? It's already been like it's at that stage. So what are some of the things that you suggest now after they've started eating healthy? Is there some kind of treatment to it?
Yeah, the treatments are, first of all, they should improve their general health. Means if they're diabetic, they should control their diabetes. If they're hyperinsulinemic, they should get their insulin levels down. If they're hypertensive, of course. And I would like to, like, even they're hypertensive, I would like to have their hypertension controlled, not with the drugs. They should try to control it naturally by doing exercises, by eating healthy, by reducing their weight, all those things. All right, so that's what it is. Now, I think how to fix it. Okay, so you have to fix your, of course, you have to fix your diabetes, you have to fix your high cholesterols and triglycerides. High cholesterol doesn't mean that, cholesterol is going to cause the heart disease. It is usually the triglycerides which are elevated, which are a problem. These are the triglyceride levels which are the culprit, not the cholesterol, unless somebody has familial hypercholesterolemia. Their cholesterol levels are in like 400, 500. I have not seen anybody, maybe they have like 300, 325, 350. I don't think that is an issue. Because from cholesterol, all the hormones are made. Okay? So if you make your cholesterol levels very low, you compromise your hormonal status. All the sex hormones like estrogen, progesterones, testosterones, DHEA, whatever, everything is made from cholesterol, right? Even vitamin D.
Right.
Okay? Everybody is low in vitamin D. So if you don't have cholesterol in your body, no matter how much sunshine you get, how will you convert it into vitamin D if you don't have cholesterol, right? So you have to have enough cholesterol in your body. I have seen people who are aiming, I want, my cholesterol is 80 and I am going to make it 50. It is in my family, Yeah. So they are aiming to be, to make their cholesterol to 50. Even 80 is high for them.
Yeah.
I don't know why people do not understand these things.
I think it's a wrong misconception that they've heard for
Exactly.
so many
I mean,
years
this
that-
cholesterol thing was a thing of the past.
Mhm.
Yes, in 80s, from 1980 to whatever, people used to think that, okay, it is a cholesterol. So you can imagine, even I used to think that way. And I had a son who was born in 1983. I used to give him eggs. I would take out the yolk and give just the white, egg white. And I regret it now because this yolk is very healthy for your brain health.
Mm.
Why there are so many mental health issues these days?
Mhm.
Probably people were thinking that, egg yolk is, God knows how bad it is.
Right.
It is not, right? So even if you are going on anti-cholesterol medicines, I think you will get stented. And I got stented. Okay. I think I have told in previously also that because this coronary artery disease was very prevalent in my family, so I thought maybe as a to protect myself, I should take Lipitor. So I took Lipitor for 6-7 years.
Mhm.
And it's not that I was not active. I used to exercise, walk, whatever. All my life I've been very active.
Mhm.
But I got my right coronary artery 99.9% blocked and I had to get stented.
Mm.
Yeah. So you see, so now I know that I think this Lipitor or anti-cholesterol medication was the problem,
Yeah,
not the egg yolk or whatever. So that is why I will tell people, please do give eggs to your kids or do eat egg yourself also. It's not that.
right.
Only the thing is that, shun away from man-made carbohydrates, simple carbohydrates. Simple carbohydrates are not the vegetables, they are complex, I'm not including potatoes in that. Okay. So complex carbohydrates are other vegetables, like whatever vegetables, like, cauliflower, broccoli, cabbage, whatever vegetables are there. Those are the ones which one should eat as much as you can. So people will have, if they are eating like 4 tablespoons of rice, of course, naturally they will have much, like maybe 8 tablespoons of vegetables cooked in it already. So when I cook rice, I add vegetables at the end when the rice is about to be, cooked. Okay, so that I don't overcook the vegetables.
Right, that makes sense.
And same way. Okay, so this is what it is. Try to eat as many vegetables as possible and healthy fats also. Healthy fats mean egg yolks or coconut oil or ghee, okay, which is from like made from butter, and people are scared of cooking in these things, and they are cooking in vegetable oils.
Which is the worst.
Vegetable oils are the problem.
Yeah.
Vegetable oil are the problem. Please do not cook in vegetable oils. And I have seen some people think olive oil is healthy and they cook in olive oil. Yes, olive oil is very healthy, but olive oil you can sprinkle on your salad or whatever and eat that way, or you can just eat 2 tablespoons of olive oil every day. That's okay. But you cannot cook in olive oil because olive oil has, you cannot cook anything in high heat. And especially in Southeast Asian population, we are used to cook everything on a very high heat. So it's not good. So olive oil, no, not for that. Not for that purpose. Yes. And breads and those things, avoid those things. Breads also, flour means blood. Yeah.
Right.
Mhm.
How about gluten-free flour? Would that be okay? Because a lot of
No,
people
no.
switch to the
Okay.
gluten-free diet.
Gluten-free flour means it does not have gluten. That does not mean that it is not going to raise your blood sugar.
Right. It still has
Or
the component.
yes. So some people are gluten sensitive. Of course, if they want, they can eat gluten-free due to like celiac disease or whatever. And some people should not eat any gluten-free or any flour also if they have any like mental issues or other issues or diabetes or hypertension, because it will make them obese and make them their liver fatty. So gluten-free flour does not mean that it will not give you fatty liver.
Right.
Or it will, yeah. So that's one thing. Or gluten, sometimes gluten, if you have any issue, if you are like stressed out also, or if you have any disease, you have fever, anything, your gut will be leaky. So that gluten will leak out of your gut into your blood vessels and make antibodies and can give you any problem like rheumatoid arthritis. And if your gut is leaky, your blood-brain barrier is also leaky. So that gluten can go into and give you mental issues or other neurological issues like epilepsy, Parkinsonism, whatever it is.
I'm sure you've seen a lot of patients, but does anyone stand out in regards to the fatty liver and how they started with the blood work and then you saw the blood work after you have seen them for a few times?
Yeah, of course. As I told you, in my patient population, I think 99% are diabetic, even if they're young. And I'm an OBGYN, so a lot of pregnant patients, as you have seen also, a lot of pregnant patients, and they, hemoglobin A1C is even raised 19 years. I just had a 19-year-old, her, glucose tolerance test, GCT, single thing was 176 with 50 grams of glucose. 19-year-old, first pregnancy. And it's not that she's not even like 28 weeks when we do the glucose. She's just like, because our hemoglobin A1C was 5.6%. So we did a glucose test, challenge test on her, and the report came out to be 176. She's just 19 years old, early pregnancy. Very early.
Yeah.
Yeah. So now coming to the, the treatment part. So, of course, they have to treat their diabetes, they have to treat if they're high triglycerides, or if the cholesterol is really very high. Early to bed and early to rise. That is also very important. Minimum sleep of 7 hours. It depends. Some people are okay with 7 hours sleep, some are 8 hours, some 9 hours, but more than 9 hours is also not good, and less than 7 hours is also not good. And, one should be sleeping, because there is a time when you sleep early from maybe 10 to 4 a.m. The brain detoxifies itself. The gut also has to repair itself, what it has to repair. And if you are eating right before you go to bed, your gut will be doing the digestive work rather than reparative work. So that way. So processed foods have to be artificial sweeteners, sodas, sugary drinks, fruit juices.
The healthy juices.
Exactly. And wherever you go, if you're staying in a hotel and they provide you, bed and breakfast, you will see that, there is there's always a glass of orange juice or something, right? It is thought to be very healthy. No. Eat one fruit rather than a juice. A glass of juice means 6, 7 oranges, right? Well, when you eat an orange, you cannot eat 6 or 7 oranges. Maybe 1, maybe 2. And that has fiber in it. This juice is absolutely no fiber. Plus, it raises your sugars also, and then that sugar gets deposited in your liver. And the fructose, fruits have fructose in it. So if you are eating like 1 orange, it will have less fructose. If you're drinking a glass of juice, it will have a lot of fructose. And the fructose, has to be metabolized by liver. Okay, so everything they have like glucose and fructose. Glucose goes directly into the blood. Fructose has first to go to the liver, metabolized there, and then released. So if that fructose is converted into fat and deposited in the liver.
Right.
Okay. Yeah. So, if your liver is compromised, your fruits also fructose. Where is the fructose? Who is going to metabolize that fructose?
So it
So
has
that is why, yes. Okay. So avoid cooking in vegetable oils and omega-6 oils. Wherever I ask people or my patients, which oil you cook? Oh, we cook in corn oil. Okay. And we cook in canola oil, corn oil. They are seed oils. Seed oils are not good for cooking. They are omega-6 fats. They're very, very inflammatory. Okay, so that is why. So it is better, and people are scared of saturated fats. Saturated fats means, okay, if it is coconut oil, it's a saturated fat. If it is ghee, butter, it is saturated fat. Yeah, but I think, I don't know how many decades it will take to get this dilemma out of people's mind. People are still, it's very difficult for them to comprehend that saturated fats are not bad. It is the omega-6 fats, which are bad, which are inflammatory, which cause inflammation in your body. Okay, so then, okay, now they will say, okay, what should we eat then? Of course, toxins, pesticides, chemicalized foods. If you are washing your clothes in a washing machine, also you should buy organic, laundry detergents, not the chemicalized ones. All right, so what to eat then? You can eat lean meats, seafood, chicken. They should all be organic because, of course, others, they give hormonal injections to make them fat, all those sheep and cows, whatever they are, okay. Okay, green tea. Organic green tea, that is very good to take fat out of your liver. Then, cruciferous vegetables, like I told you, broccoli, cauliflower, cabbage, kale, collard greens, mustard green, bok choy, watercress. They are good. And they are anti-cancer also, these vegetables. So that's an added benefit. Then, of course, if you want to eat don't eat yogurt, should not take sweetened yogurt, not ice cream. Maybe once in a while is okay, but not like as a routine.
Right.
Your berries, strawberries, blackberries, they are good. Garlic is very good. Artichoke is very good for the fatty liver. So eating sides. And fats, I already told, avocado oil, coconut oil, or ghee, butter. They are good, not vegetable oils. Then fish, fatty fish like salmon, sardines, mackerel, flax and chia seeds. They are good. Okay, so they reduce inflammation and fat in the liver. All right, so then probiotic rich food, fermented vegetables, sauerkraut, kimchi, miso, kefir. Second, now ketogenic diet. Everybody now knows ketogenic diet.
Becomes so widespread, yeah.
Exactly. Yeah, ketogenic diet is really very good. Okay, ketogenic diet means a fatty diet, right? Very, very little carbohydrates, hardly any. And that also like vegetables. No sugars, no milk, nothing, right?
Right.
Ketogenic diet is very good. It takes the fat out of your liver. Even if it is high in fats, still it will take fat out of your liver.
So it's an anti-inflammatory as well. So
It's an anti-inflammatory. If somebody has psych issues, mental issues, very common these days, people have anxiety, right? So they should go on thinking about this type of diet. Milk thistle, probiotics. These are the like, no sugars, no artificial sweeteners. Don't think that artificial sweeteners are good like Splenda. No, they cause fatty liver. They cause cancers. So not about that. So then ginger, milk thistle, artichoke leaf extract, vitamin E, dandelion root extract, choline, and there are some some supplements which are called biocaline and epigenin. And I have seen in many patients, I gave them, and in 3 months, I repeat their sonogram or MRI, whatever, I mean, I have done before to compare, and the livers have gone. I remember one patient who said, I mean, I cannot remember, but because that patient, I know her, so that's why I remember her. She said, and my sister knows her, so that is why she said, oh, doctor told, whatever the name of that patient was, doctor told her that she has fatty liver and there's no treatment for that. I said, no, let her come to me. Let me see. So she came to me, and I did her, of course, sonograms or whatever. Of course, she had fatty liver. Then what happened? I told her, do this, exercise, eat this way, eat that way. And I gave her some, like milk thistle, biocaline, epigenin. And of course, I told her how to eat and avoid all that. In 3 months, I repeated her sonogram. Her liver was absolutely fine. Now I said, go back to your doctor and tell her who told you that it cannot be treated. It does get treated. Yeah. But of course, it needs a lot of compliance from the patient as well.
It's not a supplement or a treatment. It's more of like to treat the whole root.
Of course, you have to do your lifestyle. You have to change your diet. Yeah, then of course you can give them supplements. Of course, there are the supplements which are.
Oh, that's all interesting thing, because a lot of ideas, it comes from the misconceptions that a lot of people.
Misconceptions, yes.
So it's kind of to take out those misconceptions and to help people to live a healthier lifestyle with what is going on in the research that we have right now.
I know there are, of course, if you're genetically prone to something, of course you are genetically prone. But now those days people who are not genetically prone also having those issues.
Right.
So it means that, whatever they are eating or doing or whatever their routine is, that is causing the problems. People don't sleep. They sleep at 2 o'clock, 3 o'clock in the night.
Yeah. It affects
and whatever they eat, and I ask them, what is your breakfast? Oh, I don't know, pancakes and stuff and whatever. I don't know what it is. Yes. Yeah. That is what it is. That is the problem. But still, the food in Europe is much better than food in United States.
Yes, for sure.
Right?
They bring that food over here.
Yeah. I don't know. I saw the other day, President Trump saying that, why our food is like that and why European food is much better than, why we should not do the same thing what they do.
Right.
I hope.
It's also the lifestyle that they live as well in there.
Yes, they have better lifestyle. They do not have that much obesity what we have in United States. But what caused the obesity? That we have to think about. Yes.
Yeah, and it's interesting because United States has so much more gyms and it has a higher rate of obesity. So it's not essentially the workouts, it's actually the foods.
Exactly. Everything contributes.
Right.
Yeah, everything contributes.
Yes. Any last thoughts in regards to the fatty liver or any advice for anyone other than everything that we've spoke about?
That's what I'm saying, that, people should be careful. I mean, from the very beginning. And yes, I'm telling you, if you have problems in your body, those problems will be in your offsprings also. You understand? If you have abnormal hormones or abnormal, plastics and microplastics. The other day I was listening that, infertile people who are, if you biopsy their ovaries and testes, you will find nanoplastics and microplastics in them.
Yeah.
So can you imagine? And these people, I have seen people, they go and they spend $20,000, $30,000 and getting IVF, and then they miscarry. Why they miscarry? Because they did not prepare their body for that IVF. They should, spend like 6 months to prepare their body, get all the toxins out of their body, and, everything in order, and then go for IVF if they have to, if they don't get pregnant. But I think if they prepare their body, they might automatically get pregnant. And these days, when I do tell the male partners to go on their semen analysis, I see so many abnormal. I have hardly yet to see any normal semen analysis. So I think if those male partners, if, of course, female and the male, both, they should detoxify themselves. Everything should be corrected. And I think their semen quality will also improve. And then they should go ahead if they're not getting pregnant. I think many people, they do get pregnant once they're treated and they're fine.
Right.
Yeah. So if they don't, then of course they can spend at least, I have seen many patients, and I feel so bad for them. They spend $20,000 and then they cry when I see there's no fetal heart and they've miscarried. They cry, and I feel so sad for them. I said, what can I do? I wish you guys had come earlier and, then go. And I have one doctor who does IVF. And I told him one time also, please don't do them IVF on them just like that, okay? Just tell them to send them to me so I can, see what problems they have. Otherwise, like, toxins and everything, I can clean them up, and then you do the IVF.
Because I feel like the body will sometimes not do it on its purpose because there's something going on. So
as I told you, I was listening to somebody's, this, if they're finding nanoplastics and microplastics in the ovaries and the testes, so you can imagine, what type of ovum or eggs they will be producing, and the semen analysis quality would be, right? Yeah. The same, I'm just talking about the plastics. What about other toxins? Lead, mercury. There's so many other things. If they're in other parts of the body, they cannot spare the testes and the ovaries. It will be there also, of course.
Imagine in the brain and the gut.
Of course, yes. And that is why, you see these days, lot of mental issues. People have anxiety, people have depression, people are schizophrenic, people have OCDs. They're scared, they're phobias. The other day, one patient came to me and she was saying, and then the husbands don't understand. She was saying, when I go to the kitchen, I think I feel that somebody is chasing me and is going to kill me. Yeah. You see, these are. And there's another 15-year-old. She was very attached to her grandfather and father. And grandfather and the father, they passed away. And now she has psych issues. And now they are taking her to the psychiatrists, who are giving her, not even seeing that, I did all her tests, and she is, of course, B12 is very low. D is very low. All those things are very low. So how can you just give them psych medications and think that the child is going to, for 15-year-old, get treated? It's not possible.
Think about psych, because it's one of the main things that it just goes from the symptoms instead of actually looking into the lab work and anything.
How many psychiatrists you have seen who order the lab work, or they tell the person, okay, go do these lab works at your PCP and bring the reports to me? Have you seen? No.
I haven't seen yet. So
yes, I'm saying. So they just, what they do is they just listen to their symptoms and then just write the medication.
Which is sad,
and
put the bandage over it. So
exactly. And And do they even tell these people, okay, do not eat sweets? No.
No.
Yeah, because sugars and sweets, and they never tell what type of food you eat, what you should do, exercise, how you sleep, all those, daily routine. Nobody asks them.
Right.
That's what the symptoms. Okay, do you hear voices? Do you hallucinate visual or auditory or whatever? And they just write the medication, and they will write the diagnosis. Oh, schizophrenia, major depression, whatever,
Yeah. And that becomes something that they're stuck with that diagnosis for the
Diagnosis, and it becomes like a taboo, lifelong.
right. So you're saying by seeing everything in the lab work, we can actually treat the mental illness as well.
Of course, even, and I have seen 99% vitamin D is very low, 7, 8, 9,
Yeah.
even 3, 4, I have seen vitamin D levels. So vitamin D, they say, also is the low, it can cause you depression, right? So instead of taking antidepressants, why not correct your vitamin D, right?
Right.
Do that first, see how you are. If you are getting better, that's fine. If you're not getting better, then think about, okay, taking some other thing also to supplement that.
Right. Is there a correlation between the mental illness and smoking as well?
Everything. So what does smoking do?
It affects both of
Smoking,
them,
yes.
but
Smoking, disrupts every organ of your body, the metabolism, metabolic function. So brain is also a part of your body, right?
right. So yeah, it's interesting how some people see it as a coping mechanism for the smoking, for the mental health, but
Yeah. That's what they think, because they think, okay, they smoke because they want to get rid of whatever is going on in their life. It's a kind of an addiction, right? As you say.
so there's a lot.
Of course.
And
Yeah.
I feel like if you take care of your health, I feel like a lot of the issues could be fixed as well. So it's not just one simple
Your
solution.
life routine, your eating habits, your sleeping habits, your moving habits. People don't move these days. And then your nutritional deficiencies, if they are, you should correct those, eat those. I think people will not have to go to the doctors. But do you think the doctors will want the people to get healthy? I'm a doctor also, but I'm just saying, if everybody is healthy,
Right.
but at least they will still come for a well visit or something, right?
It's important to have the checkup still, because there's always that.
No, checkups should be done. I'm saying that checkup should be done, but at least diseases will reduce. The incidence of diseases will reduce, especially these chronic diseases.
Right.
Yes, and I believe that if somebody's immune system is good, you don't even get these colds and flus. Why people take vaccines? Huh? Why don't you increase your immune system yourself?
Yeah.
That, you don't get these flus. Why you get diseases? I mean, these ordinary diseases. I'm not talking about, of course, diabetes is a factor also. If you are keeping yourself slim, and doesn't matter if it is in your genetics also, of course, you can, get rid of those, or at least, be on the safe side, and let it be in very good control. But, but I'm very that, everybody should come to a doctor, should have their lab work done, so that they see that, what could be their issues. Or if they are having an issue, it can be, catch the bud in, like early stages. Everything should be caught early, so that, it can be corrected. Once you go into kidney failure, once you go into liver failure, it becomes very difficult to control those things. Still, those things can also be controlled.
But it's harder.
It is harder, of course, but it is better if you don't go to those stages.
Yeah.
And for that, of course, you have to, I don't know, people should, even their kids, that's the way they should raise their kids. They should give awareness to their kids. So kids also know, what is good, what is bad.
Right.
Yeah. Don't buy them, these, I don't know, M&Ms and whatever, candies and chocolates. Yeah, if they want to eat chocolate, give them a dark chocolate.
Yeah. I have a
Right?
friend who's super aware with her child that she doesn't do anything like of the sweets or anything like that. And
Mhm.
I find it super interesting because I feel like the new generation is becoming more aware of what we actually put in our bodies.
Yes,
So
yes,
I like that. Yeah, it's very
of
interesting
course.
to
Yeah.
see. Mm.
Mhm.
But any other last thoughts or anything else that you'd like to add? I feel like we spoke a lot, so.
Yeah, but that's what I'm saying. People should. This is my. I don't know how to make the people aware of what they have to do and how they should raise their kids, how they should spend their life, how to get rid of their diseases, how to not get diseases.
Right.
Yeah. So this is very, and when I was in medical school, I never heard of any autoimmune diseases, hardly any cancer.
Mhm.
Now every other person you hear, everybody in anybody's family, anybody's friends, people have cancers.
Yeah,
People
that's
have autoimmune issues.
awesome. Another
Mhm.
thing I wanted to speak is about two of them misconceptions. One is for the Diet Coke or anything
Oh,
part of
no,
like,
no, 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 no. Yeah, yeah, yeah. I
let's
am
talk about
glad
that.
you brought this because Diet Coke has aspartame in it, right?
Mhm.
So aspartame, if you have to drink Coke, it's better you drink regular Coke
Right.
rather than this Diet Coke. Diet Coke gives you insulin resistance, give you diabetes, and all these things cause cancer, right?
Yeah.
Would you like to have that? No. Yeah, once in a while, if you're drinking Coke, if you have to drink Coke, then better to drink regular Coke than Diet Coke.
Right.
Although I'm not favor of any type of Coke.
Right.
Drink water.
Or any type of food that says the diet word in front of it. I feel
No,
like it's
no,
just an
no, no, no,
advertising
no,
thing.
no, 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 no. I don't know what type of diet. Read the ingredients, what
Right.
it says. Like, I don't know what they put, the high fructose corn syrup they put, whatever they are. I don't know what what they have in the regular Coke. And once I thought I will check what is the ingredients of the Coke. And you know what it was? Oh, to check, find out about the ingredients, call 1-800 number.
So they're not even there.
Yes. So who is going to call 1-800 number? Right? Yeah.
And stay on hold for an hour.
Exactly. Yes. Stay on hold. And who knows, they will give you the exact list of what it has. Who
Right.
knows? Then they will say, oh, this, and you keep on writing what it has. And then you check, go on Google and see what this means, what this means, what that means. Yeah.
Yeah. Another misconception is that healthy food is not something that tastes well.
No.
So,
Healthy food may not taste well, good. But
so
the problem is that if you know what is good and what is bad for you, you will do that. Okay, suppose one is diagnosed with cancer. And if I tell that person, you have to eat this to get rid of this cancer. So then you will not have to do chemotherapy, radiotherapy, and all that stuff. That person will do it because now he is determined. He
right.
knows he has cancer and he will ultimately die. Right?
Yeah.
That person will do. But I want everybody to be determined like that.
It's the motivation
It's
that's,
the motivation. Yes, you have to get motivated.
yeah. Another thing that I found it interesting is when a lot of the parents say, I will die for you, I will do anything. But instead of dying for me, would you actually live a healthy life for me?
Yes, yes,
And I think
yes,
that's more important to change the like what we say to ourselves and to our kids
yes.
instead of actually saying the reverse. So
Thank you so much for joining us on this journey to better understand fatty liver disease. I hope our conversation with Dr. Sajjad gave you fresh insights into how lifestyle factors environmental toxins, and especially mental well-being can greatly influence our overall health. Remember, at Neurona QL, I believe that by nurturing our neurons, our brain cells, we can create a life that is not just healthy, but also truly beautiful and fulfilling. If you found this episode helpful, please like, subscribe, and share it with someone who might benefit. A big thank you to Dr. Sajjad for her valuable expertise, and of course to all of you for tuning in. Stay connected for more inspiring conversations here on Neurona QL, where we continue to explore the incredible power of the human mind and how it can transform every aspect of our lives. Until next time, take care and keep making the most of those amazing neurons.